Hello, this is Dr. Gay from First Look MRI, and this is a 20-year-old male with a history of a falling injury and shoulder pain. He went to see his orthopedic surgeon, and they suspected a tear of his labrum, so they did an MRI here, and this is with contrast. This is what an MRI of the shoulder with contrast looks like. There is a round area here. This looks like an egg. This is the humeral head. This thing that looks like a golf tee here, this is the glenoid, part of the scapula that goes way back here. These are the muscles in front and back, and we see that the joint is distended with contrast. In this case, the contrast is white on this sequence. So there's white fluid in front, white fluid in back, and this is the joint capsule getting distended by that fluid filling the joint. And when the fluid is in the joint, it surrounds the structures. If there's a tear of the rotator cuff, it'll leak out of the joint. And if there's a tear of the labrum, it'll outline a labral tear. And this patient does have a labral tear, and this is a good example of how the contrast does help outline the labral structures. So one more bit of anatomy. This is the biceps tendon here in a little cup called the bicipital groove. And here we go. So this is the joint capsule in front, looking good. We have a little line here. This is a normal structure, the middle glenohumeral ligament in front. But in back we have another structure that is not attached to anything. This is a free little fragment back here. This is the joint capsule, and so this is laying in the dependent posterior portion of the joint. And this is a torn labral fragment. A piece of the labrum is torn and flipped back here. And if we look for the donor site, we see right over here, there's a little bright area arising from the posterior labrum. So the glenoid, the bone here that looks like a golf tee, has a little rim of cartilage called the labrum. This is the front, and this is the back. It goes all the way around the circumference. This is a normal appearance in the front, a little dark area. But in back here we see how this is smaller, and it's undermined by a little bit of this white joint fluid that goes underneath. So this is where we should see a dark triangle here. Instead we see bright fluid in the small labrum, and this is the donor site for this fragment. So this used to sit here, it tore and drifted back here in the posterior dependent portion of the joint. So we say there is a tear of the posterior labrum with a torn and displaced fragment back here. And so the orthopedic surgeon will go in there and take a look. But this is another, again, a nice example of why contrast can be helpful if you suspect a labral tear. It'll outline the structures, the contrast is bright. Without the contrast, we probably would see this fine as well, because fluid will be in the joint when you have a labral tear, and it'll distend. But this is much more distended, in the contrast between the fluid and the labral tissues is better whenever you put the inject IV contrast into the joint. And that's it, a displaced labral fragment from the posterior labrum.